Hey guys, I'm John Kwan. This is Matthew Shahab. We're both doctors of physical therapy at Core Performance PT. And today's segment is upper body foam roll series. Now, foam roll is a really good way to increase mobility through the glenohumeral joint, your shoulders, your shoulder girdle, also activating the core as well. So we're going to show you a two-part series that's going to be really good for you to do at home just to maintain that motion through your shoulder. Great. Matt is on a foam roller. You can pick whatever color works for you. Light is the easiest, less dense. If you want to go harder, you can go with the black. But find a density that works for you. He's in a very, what do you call it, like a sagittal position on the foam roller in midline through his spine. His abs are tight, so if you notice that his abs are not like flared out, he's actually engaging through the core. So that's actually stabilizing his movement. Shoulders are moving into a flexion position. He's not going into that impingement position. He's opening up his shoulder a little bit so he has better clearance. Do about 10 to 20 reps, and then you want to switch to your T motion. So T motion, he's expanding his chest. He's squeezing through the shoulder blades, activating the periscapular muscles, expanding his chest, and getting a nice lengthening feel through his pectoral muscles. And then you want to go into your Ys, so crossing your arms, opening your shoulders a little bit wider than the previous motion. Thumbs are elevated. He's really trying to stretch his arms out and try to touch the ground if he can. Again, pain is your guide. And then expanding his chest, but at the same time maintaining core activation. If that's too easy, you can progress to light dumbbells. You don't need heavy, like 20-pound dumbbells, something light, 1 or 2 pounds or 3, whatever works for you. This is more of a mobility exercise rather than a strengthening exercise, so don't go too heavy with this movement. Again, the weight is going to help to increase that lengthening feeling in your shoulder girdle and your glenohumeral joint to get that range of motion. Good. Same thing, I's, T's, and Y's. Perfect. 10 to 20 reps, do what you can. Good. And then you want to go into a more static stretch position. He's relaxed, he's breathing, his arms are extended, he's really letting gravity stretch out his pectoral muscles. Great way to really, lengthen that shoulder, open up that shoulder. And then if you want to up the ante, you can get into that more of that external rotated position, and that's going to cause more lengthening, stressing different fibers of the pectoral muscles. Good. And obviously using some weight to give you added resistance to the stretch and allowing gravity to push down and creating more range of motion through his shoulder. Now, if you want to make this a little bit more challenging, you can use a little step stool. You can put it underneath his feet. Dynamically, his knees are going to be engaged, his feet are together. The more narrow that your stance is, the harder it is to really activate the core and stabilize the movement. Because not only is he moving dynamically, but he's really trying to stabilize isometrically through the core. It's not easy to stay in this position. How are you feeling, Matt?
It's challenging.
Right, where are you feeling this?
Mainly my core.
Exactly, so core is stabilized, shoulders still moving, so it's kind of a mobility / stability exercise. Great for the core, great on lengthening your shoulders and getting a good stretch. You can do it pre or post workout. Try it at home, use pain as your guide. Have fun with it, guys.